So we start the next session, and for the first talk, we have Dr. Anna Smolle, and she'll be speaking on influence of unplanned excisions on overall survival in patients with soft tissue sarcomas. Results of a multi-center study, including 728 patients.
Thank you. Thank you for giving me the opportunity to present my talk at the APMSDS in Jaipur. Unplanned excisions are not uncommon, unfortunately, in soft tissue sarcoma. Treatment at the tumor center, as you may all have experienced, is complicated by unclear resection margins, missing preoperative images, and inappropriate skin incisions that are used by the primary surgeon. We therefore wanted to know which factors differ between patients with and without an unplanned excision. Furthermore, we wanted to know whether further treatment is affected by presence of unplanned excision or not. And even more, we wanted to know whether unplanned excisions have a prognostic influence on patient survival. Therefore, we included 728 patients from 3 European tertiary tumor centers. All patients had either undergone primary resection at the tumor center or an unplanned excision with re-resection at the tumor center. There was equal gender distribution, and the mean age was 58 years. Unplanned excisions in our cohort were performed in nearly 40% of patients, and these unplanned excisions were more often applied in patients who were male with a small tumor, a long duration of symptoms, a superficial tumor location when tumors were located in the upper limb, and tumors with a low stage. Non-significant factors included histology and grading, and moreover, depending on the tumor center, there was no significant difference in the rate of unplanned excisions. Coming to the differences in therapy, upon re-resection at the tumor center, plastic reconstruction was more often necessary, although tumors were significantly smaller in patients with unplanned excisions. There were muscular flap skin grafts or a combination of both most commonly used. Radiotherapy was also more often applied postoperatively in case patients had undergone an unplanned excision and re-resection at the tumor center. However, interestingly, there was no difference in postoperative complications between patients with and without an unplanned excision, and these rates were about 20% in both groups. Coming to the overall survival, one should think that patients with an unplanned excision, as they have been inappropriately treated at outward center, would have a worse outcome. However, as you can see on the Kaplan-Meier survival curve, patients with an unplanned excision did significantly better, and that has significantly better overall survival. And therefore, one may conclude that 2 resections for a tumor may achieve a better local tumor control, and therefore the survival is better. However, it's not that easy. As you know, there are differences at baseline predisposing to an unplanned excision, and these factors are also very important prognostic factors as tumor size and location. And therefore, we had a statistical solution to account for these factors, and it's called the inverse probability weighting. In our case, the inverse probability of UE weighting. What does this mean? We have 2 patients in our cohort, and this is actually from our data set. They don't differ between major prognostic factors or factors we included into our analysis, but one underwent an unplanned excision and the other not. And when calculating a propensity score, meaning the propensity of the patient to undergo an unplanned excision or not, and subsequently calculating the IPUEW, we receive a data set randomized for an unplanned excision as if we had a randomized cohort in the retrospective setting, and patients were randomly assigned to unplanned excisions or not, which would not be possible in reality. And when recalculating our Kaplan-Meier survival curve after weighting the whole data set for the IPUEW, we discovered that the statistical significance in terms of overall survival is lost, and patients with an unplanned excision do equally good or bad as patients without an unplanned excision prior to referral. So the morbidity in patients with an unplanned excision is significantly raised due to extensive re-resection requiring plastic reconstruction. Moreover, the unclear primary resection margins necessitate significantly more often postoperative radiotherapy. However, at least to our results, there's no significant difference in terms of overall survival between patients with and without an unplanned excision. Nevertheless, we are unable to assess the favorable prognostic factors between patients with and without an unplanned excision, and in terms of their small tumors and the superficial location, probably more aggressive treatment in patients with an unplanned excision. And therefore, we assume that patients with an unplanned excision would have actually done better if they had been treated primarily at the tumor center, and therefore unplanned excisions should be avoided by all means. And lastly, I want to invite you to the EMSOS 2020 in Graz. It's my home city. Thank you.